Each year on November 14, we celebrate World Diabetes Day. This year, the month of November also marks the first anniversary of the European Parliament resolution on the prevention and management of diabetes, which acknowledged the urgent need for action. Today, 61 million people live with diabetes across Europe. 1/3 of them will develop cardiovascular diseases, diabetic retinopathy, and many other potentially life-altering complications during their lifetime. To lower this risk, we urgently need to implement the right policies, notably on improving timely, uninterrupted, and affordable access to medicines, technologies, education, and care for all. This should be a basic right for people living with diabetes, as these are indispensable for them to achieve the best possible health outcomes and enjoy the highest possible quality of life. As an IDF board member and a healthcare professional, I call on all governments to guarantee access to early diagnosis and to the right treatment at the right time and the right place for all those who need it. Recent medical and technological advances truly have the potential to improve diabetes management and reduce the burden of the condition, and must be accessible to all. We urgently need a collaborative pan-European approach to assess and deploy new treatments and innovations swiftly and fairly. Diabetes disparities are glaring, with unequal access to care based on geography, economics, and education. Rural and economically disadvantaged areas face obstacles in timely diagnosis and affordable treatments. The economic burden and digital divide further exacerbate inequalities, making it imperative to prioritize policy initiatives that address these disparities, ensuring universal access to essential resources and knowledge for effective diabetes management. By working hand in hand, we can strive towards a future where no one is burdened by the consequences of this pervasive health challenge. World Diabetes Day is an opportunity to unite the diabetes community and raise awareness of what still needs to be done to achieve our objectives. There is a pressing need to intensify our efforts to effectively tackle diabetes, one of the most critical public health challenges of our time, and to ensure that no one is left behind. That is why I'm delighted to announce that IDF Europe is now working on amplifying the achievements of the EU resolution across the entire Europe region through a high-level technical summit on diabetes in collaboration with WHO Europe, which will take place in Serbia and Belgrade on the 28th to 29th November, and which we hope will guide further policy action. Together, united, let's accelerate action on diabetes.